Look, from where I see this and the trust gap that exists, I think that the whole purpose, the need for organisations to adapt how they act, how they respond in this time has increased more than ever. You know, in Boots, it's something that we talk about a lot. We were really proud to score highly in the, we scored number 3 in the RepTrack survey. But that to me means that that now comes with a continued expectation to refocus on purpose and to refocus on the needs of society. And actually, you know, I'll speak a little bit about it from our own perspective and what we saw through this crisis. So for me, what I saw was that COVID really highlighted the need for businesses to reconnect on their core purpose and to respond to the needs of consumers and to respond to the needs of society. And from a Boots perspective, we get a lot of appreciation for the work that we do in communities. We're a pharmacy-based business, and we got a lot of appreciation for the role that we played through COVID. Very simple things from, you know, connecting with the vulnerable, making sure that patients received their medication, and that we created a safe environment for the public, actually, because we were one of the few retailers that continued to be open throughout the whole of the crisis. And it was very challenging in the early days. But as we moved through the COVID situation, we saw other things come to the fore. And Moira referenced it a few minutes ago when she talked about the very unfortunate rise in domestic violence, and the numbers around that increased very drastically through that time. And actually, one of the things that we were able to do was to respond to that quite quickly with the Safe Ireland organisation. And because of our coverage across the country, we were able to create a safe space. So for anyone who was affected by domestic violence, we created a space in our pharmacy consultation rooms where they could go in and they could access local information. So the information that they needed in their community to find out what they needed to do, or who they could contact, or you know, just the general advice that they might need in that situation, in order to look after themselves, to protect themselves. And actually, some of the feedback that we had from what seemed like quite a simple action actually was very changing, and definitely changed the situation and the lives of many families. So that was something that, you know, we were able to respond to through this crisis. It was something that prior to this, the awareness of that hadn't been what was needed, and we were able to create that. Equally, you know, we've seen situations with you know, the increase in anxiety, mental health issues, people needing additional support. You know, so, and again, being able to support that, we've been involved with the Green Ribbon campaign for a long time, but, you know, being more proactive about mental health and the awareness around that, again, it was something that increased through the COVID situation that we've been able to react to. And, you know, our business has been able to respond in a way that has made a difference and supported local communities through those situations.
And can I ask you, because obviously I think one of the leadership lessons from this last few months, if I read Julie and Mark correctly, they've all been about, I guess, bravery. And it was very brave to look after domestic violence. You know, it's probably not a glamorous subject to support when you look at your traditional charity community. Was it hard to make that decision, Bernadette? How did you come about to realizing that was the role for Boots at this point in time?
Look, I would say that the Boots company was founded 170 years ago, and it was founded around a purpose. And it was a purpose to really bring affordable healthcare to those that were less well off in society, to those people that were disadvantaged and that needed help and maybe couldn't access it or couldn't afford it in the situation that they were in at that time. And actually, our role as Boots Ireland is something that we take very seriously. We're really, really committed to that. And our colleagues love it. You know, our colleagues are the people that help us, that drive us, that help us to decide where we should invest our energies and you know, just put our efforts into. And actually, we do, as you say, work with a large number of organisations across Ireland. We've had a number of partnerships, and let me just tell you about some of those for a moment. So, one that is people will be very aware of will be our partnership with the Irish Cancer Society. We've had that since 2012, and part of that is where we raise money for night nursing. So the money, the effort that we put there, that goes to raise funds for night nurses, and those night nurses are able to go into homes right across Ireland, across all communities, for everyone, so that people can die in the comfort of their own homes. They support those final days, they support families at that time, and it is incredible work actually that they do. And you know, it's that part of our partnership we are very proud of. And we're also able to do things at our shops. So we're able to provide cancer advice through our pharmacists. They will signpost where people should access information. And actually, we're also able to, we have what's called Boots Beauty Cancer Advisors. And those colleagues are trained on how to help people with the visible symptoms or the visible effects of their cancer treatment. And it's a great partnership that we have, and you know, the feedback that we get is amazing. But that hasn't stopped through COVID. Those needs still exist in this time, and actually one of the things that we have been able to do is adapt how we work that. So we've been able to create virtual consultations with our beauty advisors. We've got many colleagues who are participating in virtual walks and millions of steps and continuing to support that and that fundraising. And that will go to continue to support those situations that haven't gone away. They still exist, and we need to be able to create opportunities to support them. You know, a couple of other things that we're involved with. One is the Understand Together campaign. So that's something, again, probably close to a healthcare agenda, where we know that there are now 55,000 people living in Ireland with dementia. And one of the really important things for them is that they can continue to engage in their communities. And through a partnership with Understand Together, we're trying to make sure that we have dementia inclusive communities, and simple things like, can those people, can they shop, can they engage with their normal routine, and how can we work together to remove barriers to allow that to continue to happen. It's really important work, and I think that is something that we will see growing over the coming years. So we need to think about how we will support that in our communities. Absolutely. And Thomas, the final one I'll talk about a little is our work that we do through business in the community with the education program. Again, it's really important work for us because it's mutual benefit. It's benefit for our business, but it's also benefit for the people that we interact with. And what we do is we have partnerships with a number of DEIS schools, right from Letterkenny to Cork and Tala and lots of places in between. And we work in particular with disadvantaged areas and pupils that would have come from families where there's maybe no employment history, they don't have the skills within their remit, or the people they interact with on interview skills or communication skills, or things that will make the difference in getting them into a life where they can get employment, fund themselves, be independent, have families, all of those things that you know, many people strive to do. But we see that actually, and we get lots of feedback from students around the benefits that that has given them. Many just engage more with school and stay on, do their exams, and as a result get a career and have you know, better outcomes. But actually for us as a business as well, it's been really good because we have been able to involve our teams, involve our colleagues, and they develop skills too. So they're able to develop their skills and coordinate a program, for example, or they also get to see the importance of inclusion. And we'll try to involve our store managers, our graduates, so our pharmacy intern graduates who come into us at that early stage of their career, giving them the opportunity to see what all of our society looks like, and to really see the importance of inclusion and the difference that they can make through small activities that you know, we can invest in. And you know, we do get great direction, encouragement, and you know, support through business in the community, and it's a partnership that works very well for us too. So I know Maura mentioned it earlier in our intro, but you know, we're delighted to be part of that as well. We see the difference.